what it's potentially suggesting is that it's not just a matter of continuing to take various medications. There is some level of self-soothing that we can do with this. So being in the fitness field, what you hear a lot of times is people discussing the merits of exercise as an antidepressant versus taking actual medication. This is something that you hear nonstop because it is an interesting thing to consider is, can you get the same or better results just by exercising? So I'm going to do my best in this video to answer that question. My name is Andrew with Pride Movement Fitness. Let's get into it. So in 2000, they did a randomized control trial on 156 people. They split it up into 3 groups. They had one group that was taking 50 to 200 milligrams of Zoloft. They had one group that was exercising in a group setting 3 times a week at 70 to 85% of their maximum heart rate. And then they had one other group that was doing a little bit of both. The variance on the Zoloft was obviously depending on how intense the symptoms of the depression were. And truthfully, the outcome of that was pretty interesting. What makes this study even better is that it wasn't something that was just a short period of time. They did the 4 initial months of actually going through the study, and then they did a 10-month follow-up with people as well. And what they found is that they were getting pretty similar results as far as decreasing people's symptoms of depression, whether it was exercise or taking medication, which suggests that it can be equally effective. It's very likely that if you're, and this isn't medical advice, but it's possibly something you could talk to your doctor about, especially if you're someone who's dealing with really, really intense side effects from the medication. But it does bring up the possibility that this is something you could look into for yourself. It is something that I personally did. I was on antidepressants at one point and I'm not anymore. Again, not medical advice. But what about when it came to the 10-month follow-up? When they did the 10-month follow-up with these people, they actually found that the exercise group, the one who was just exercising, actually had a significantly lower rate of relapsing back into depression. But even more interesting, in my opinion, is that the people who were only taking medication, who started exercising, saw a 50% greater decrease in their depression symptoms. So again, what does that really tell us? What it's potentially suggesting is that it's not just a matter of continuing to take various medications. There is some level of self-soothing that we can do with this. But in my mind, what's the worst case scenario? You might feel a little healthier, you might get a little more fit. They ended up doing one more study at Duke where they ended up cutting out the group atmosphere aspect of it. Because you might be thinking, well, they were doing group atmosphere, it might have been the social aspect of it, which was kind of my initial thought, honestly, but they actually found very, very similar results even when you take out the group atmosphere. When they had these people working out and exercising at home, you get the same effect. On yet another study of over 500 cardiac patients, they found potentially there's a link between the kind of exercise and how long you're exercising. So, and even how intense you're exercising, because that might be what a lot of people are thinking. Okay, I'm gonna exercise. Does that mean going for a walk? Or does that mean playing basketball? Or does that mean go and do like a CrossFit session or something like that? And it seems that there's a little bit of benefit with everything, but there is a bit more of a benefit when it comes to high intensity exercise. So, and something that's a little bit more aerobic. So picture something that's a little bit more cardiovascular as opposed to just strict weightlifting. But like I said, it was a study of over 500 people, and one thing that they did consistently see is that the better somebody's aerobic capacity got, the lower their symptoms of depression got. And then in a study alongside that, they also found that when it came to high intensity exercise groups versus low intensity exercise groups, depression symptoms would go down 50% for the high intensity group versus the low exercise group, where they're only decreasing it by about 1/3, which was the same as the placebo group. So when you put all this information together, you might be thinking, okay, so what the hell do I do then? Because you're getting a lot of conflicting stuff, a lot of things that seems to be suggesting, you should do this or you should do that. Right now, the proper amount of exercise, or what is correct, seems to elude us. One thing that we can see for sure is that if you are exercising, your body likes it. So we can just leave it there, guys. Until next time, my name is Andrew with Pride Movement Fitness. We'll see y'all later.